Thailand's national health insurance boasts 99% coverage, with the poor paying just $1 to see a doctor. Thailand's economic development is expected to turn the country into the status of a developed country in the next 20 years. Advancements include medical technology, which are continually improving and will soon be on par with neighboring countries in Southeast Asia. The country is even seeking to learn from Taiwan, which has high medical standards.
My father listened from other people, they are refusing, so he started crying that what will happen with us.
In order to protect the identity of these refugees, we have deliberately avoided using their image. In 2017, there are more than 650,000 refugees stranded in Thailand, with more than 500,000 being stateless. Beginning in 2015, Ziji has been entrusted by the UNHCR to hold a free clinic every month to provide assistance to sick refugees who have no other place to go.
I have already gone to the hospital, but it's not very helpful. They haven't been able to treat me.
I think we have every medical department because we have nearly 20 doctors who came to help.
Every month, the large clinic services some 600 to 700 patients, which are refugees from many different countries. This is because most Thai people can enjoy the benefits of universal health insurance. Thailand in 2001 began national health insurance with coverage reaching up to 99% of the population, with most paying just $1 to visit a public hospital, which is cheaper than that of Taiwan.
เวลาพูดถึงระบบบริการก็จะมีอยู่ส่งเสริมป้องกันรักษาฟื้นฟู
Our health insurance system has four aims: health promoting, protecting health, therapy, and rehabilitation. These are the services we want to provide with good quality.
คือบริการที่ได้รับนะครับ
This is Thailand's NHSO 1330 telephone service center, where the general public can get information about the major medical services provided by large hospitals. If one has an opinion or comment they would like to offer, they can call here, as it operates much like a customer service hotline.
Problem with service: you can call, and this is the first-class service.
Thailand's medical development, in addition to the implementation of universal health insurance, is now pursuing better medical quality and higher technical standards. Here, extra measures have been undertaken to allow us to enter and film a surgical procedure in this hospital's operating room. This is the Renaissance system, Thailand's first 3D computer-aided surgery system for minimally invasive surgery with a robotic arm. It is mainly used for spine surgery, and currently more than 20,000 successful surgery cases have been accomplished. 4 years ago, it was introduced to Taiwan's medical community, though it is just beginning in Thailand.
It looks like a soda can, small one.
Dr. Soryuth Chomnavij is the first physician to use this high-tech equipment in Thailand. In February 2017, he also arranged 3 medical staff to study the relevant technology and learn from a hospital in Taiwan to assist in the surgical treatment.
Taiwan has professional skills and technique, which I saw when I studied there. I brought much of this experience and my study back to our hospital.
We study how to operate this equipment, and nurses have to listen to the doctor, who gives guidance to perform this surgery technique.
We first needed to let our nurses understand the work of the system and the work process to understand how this machine performs surgery. Second, the nurses had to study hard and come back to assist our doctors with this work.
In Taiwan, Renaissance system is employed at 4 hospitals with thousands of successful surgeries. And however, Thailand only saw this technology introduced in November 2016. To the first half of 2017, there are only 40 vertebral surgery cases and 2 cases of brain surgery.
Insert the needle.
Although Taiwan's medical standards are higher than that of Thailand, the latter is making great progress. And in April 2017, it used this robotic arm to complete Asia's first brain surgery.
Most of Taiwan's focus is on the spine, and they have done a good job solving the patient's problems and improving their quality of life.
แล้วก็เพิ่มคุณภาพชีวิตให้กับคนไข้ได้
As Thailand develops, medical standards are gradually taking off. This industry is estimated to be worth $1.9 billion in 2017. This includes equipment such as gloves that are being used in surgery, which accounts for 50% of Thailand's medical exports, which actually come from the Taiwan business.
These machines were developed by us, and later we learned that the materials come from here, so we moved our factory here.
The parent company of Taiwanese businessman Deng Dongyin's operation is actually Taiwan's largest producer of masks. Because Thailand has a great deal of rubber raw material, he came 3 decades ago. He set up a factory which not only serves the domestic market but also does exports. Medical surgical gloves occupy some 47.7% of Thailand's medical products export market, which is valued at $200 million.
Thailand production is not only supplying Thailand, but it's also being sold to Taiwan and neighboring countries near Thailand, like Myanmar, Laos, and Cambodia.
Thailand's medical sightseeing every year attracts 2.5 million patients from Japan and the Middle East. Medical tourism output value of about $200 million, accounting for 40% of this market in Asia.
Thailand hospitals began to transition to take this high-end business to attract those from the Middle East to do health checks, heart surgery, etc. In fact, many hospitals in Thailand are ahead of those from Taiwan in medical tourism.
Thailand's medical tourism industry is different from other Asian countries, as it could be a useful reference for Taiwan. Some believe that Thailand's medical resources are too focused on private hospitals. A doctor-to-patient ratio of 1 to 2,000 shows a serious doctor shortage. In the future, Taiwan and Thailand can continue to have medical exchanges, as there may be more opportunities for cooperation.